Welcome back to the Health Tech Edge. My name's Mike Moore, and in this season on AI agents in healthcare, we've talked about governance and data and workflows and ROI, and now we're going to shift to the front lines of care operations where AI agents are already driving meaningful results. Hospitals today don't need more dashboards, they need AI agents that take action and help care teams work more efficiently. Our guest today is Toryn Slater, Area Vice President at Qventus. For more than a decade, Qventus has helped health systems use AI, behavioral science, and machine learning to transform care operations. Their platform powers AI operational assistance across inpatient, perioperative, and surgical care settings, helping hospitals reduce administrative burden and improve efficiency so clinicians can focus on patient care. Toryn, welcome to the show.
Thanks, Mike. Super happy to be here.
Yeah, thanks for it. I think, this is something that we hear a lot about AI in healthcare and kind of all the different facets of it, where it can fit in. And I think it's meaningful to get different points of view and hear about the real work that's happening, that it's not theoretical, that people are actually implementing solutions today. And obviously, Qventus and the team there, you guys have quite a track record for doing this. So I'm excited to dig in. Uh, Let's go ahead and start with the term that I used in the opening, which is I think it's a term that you guys have coined here, AI operational assistance. Maybe you can explain what you mean by that and why it matters in kind of the context of hospital operations.
Yeah, thank you. Let me just start by kind of providing some additional background on kind of Qventus and our journey and kind of how we came to define that AI operational assistant term. So as you mentioned at the onset, we've been doing this now for 12 or 13 years. And our core focus really is leveraging AI and machine learning to automate care operations. And we've built these purpose-built teammates that are, leveraging LLMs and agentic capabilities really to take action on behalf of care teams and reduce a lot of the below license administrative burden that, say, a case manager on the inpatient side or a nurse on the pre-admission testing side would be doing historically. So AI operational assistance is just kind of our way of, to your point, like making it clear that there's relevant applications within healthcare and care operations specifically, where you can leverage AI meaningfully in ways that let clinicians be clinicians, right? Like instead of having a physician or a nurse or anyone else that's part of that care team focus on what we call below license work, right? That could be digital record retrieval. It could be sending faxes. It could just be something as simple as scheduling a phone call, right? We want clinicians to focus on patient care, and technology and AI specifically is really good at ensuring that those jobs to be done, are completed meaningfully, right? AI is never going to forget a task to be completed, whereas a clinician's probably too busy and often may forget that. So this AI operational assistant term is really intended to kind of shift the paradigm from within healthcare. I think historically we've had a lot of systems of record, right? Where it's you have your data consolidated in an EHR or another system of record. But up until now, it's really been on the user of that system to actually take the action. Whereas now we're incorporating, again, agentic capabilities into that so that we can support a lot of those glue roles administratively and make them more efficient. Now, our goal never is to replace clinicians. We're not in the business of clinical decision support, but really augment them as they support patients along their care journey to really be more efficient and, again, focus more on patient care and less on that below license administrative work.
Yeah, and I think your point is a good one. I think we all think, no matter what job you have, whether you work in healthcare or not, we all think about something that needed to be done that we asked someone else to do, and we're following up with them to ask them if they actually did it because we
Right.
didn't see anything that kind of confirmed that it took place. It's the ability now using these operational assistants, if I'm understanding right, to make sure that things get done, right? That
Exactly.
that if you did your piece of it, it's going to be handed off to the AI operational assistant. Um,
And
the other piece that kind of I thought of when you were talking too is I've seen somewhere in the industry someone talk about AI nurses, and I was like, oof, I'm married to a registered nurse. Software can't be a nurse, right? They
no,
don't have the decision making, the experience, and all that, and they don't hold a license. So there is that element of it that some are promoting terminology like that I think is kind of dangerous for a variety of reasons. But I think your point is we're not replacing the humans; we're supporting them with the operational support that they need to be effective and work at the top of their license.
that's right. Yeah, no, our goal never is to replace nurses in any form or fashion. If anything, it's really augmenting what they can do and enabling them and empowering them to really serve patients as they see clinically fit. And again, focus on patient care instead of a lot of that administrative burdensome tasks that they may get bogged down with today, just given the relative slow adoption of technology and healthcare as we know it. I think it's also, the last thing I'll say, particularly relevant in healthcare, because you have these relatively fragmented care teams, right? So if you think about a patient journey, more than likely, even if I'm just gonna, end up having to get a relatively low acuity elective surgery, maybe I got referred initially by my PCP. That triggers a consult, maybe with an independent surgeon that isn't even affiliated with the hospital that I'm going to get my care at. And then let's say, unfortunately, a complication happens in surgery and I end up admitted, in an inpatient unit at a hospital. That's a whole different set of care team that's, maybe some portion of those physicians may be employed, some may be independent or affiliated. And again, no one is really project managing that process end to end, right? Like we think about in our day-to-day world, or at least in mine, SaaS, right? Like there's something or someone is always going to project manage what I'm doing, whether it's a technology or a supervisor or someone else on the team. That role doesn't really exist in healthcare because, primarily it's led by clinicians. And that isn't to say that there aren't a lot of administrative folks in healthcare that are doing everything they can with the limited resources that they have. But that's another way to think about these AI operational assistants, is like it's helping the individual member of the care team be more effective, but then it also serves as kind of an air traffic control or like an orchestrator as you think about cross care team collaboration and performance. That is ultimately, our goal is to make sure patients have a delightful experience, then ultimately that they're treated in a clinically relevant manner, and their overall care continues to be excellent, and they're getting, whether it's discharged on time or scheduled for surgeries far enough in advance or optimized ahead of surgery. Like patient care is always going to sit at the forefront, and then we're kind of sitting in the background figuring out how we can make some of these processes more efficient and more kind of ensure that they get completed end to end in a more timely fashion.
Yeah, I mean, we talked to Mike Doctor a couple of episodes ago, who's the CEO and founder of Doc Health. He's also a pediatric gastroenterologist, and he used the term, patients are projects, right? But in the world of software, we have project managers, we have project management software. We just don't approach it that way in kind of the world of patients. But there are a lot of tasks, right? Every interaction and kind of all the follow-ups. So kind of using that as a segue, I think you talked to me when we were speaking previously, kind of preparing for this discussion, about an early experience that Qventus had around an emergency department and specifically boarding, which, if people aren't familiar with that concept, I think if you watch The Pit, which has been a very popular show this year, you're seeing people stuck in the emergency department because there are no beds for them in the rest of the hospital, right? So that's what the boarding concept is that they may be in a room, they may be in a hallway, but they're waiting for a bed to be admitted somewhere else in the hospital. And Qventus, I think you said that was an early experience creating a solution around managing that with a command center. Do you want to talk about that story?
Yeah, and thank you for giving me another TV show to add to my ever-growing list.
Oh
I'll have
yeah.
to get familiar with that one, but yeah, I think that's a good question. So, and it kind of goes back to this notion of these AI operational assistants and the system of action rather than a system of record. That's kind of the distinguishing segmentation that I at least think about it. And you're right, Qventus, as I mentioned, we've been doing this for the last 12, 13 years. The company actually started as purely just an analytics company. The name was Analytics MD, and we had a bunch of really bright, sharp data scientists that were really, really good at predicting things. One of those were like, ED boarding time specifically, and discharges, and like everything associated with patient care within that realm specifically. But what we found was that like a prediction alone is not super relevant to anyone else aside from the person kind of reviewing that prediction, right? Again, that's where kind of this like care coordination aspect and the system of action becomes increasingly like evident as a necessity, because a dashboard is only as good as it provides an insight, but the actual implementation of that insight, that's a whole additional set of jobs to be done, and like a entirely different like paradigm shift that we kind of had to learn the hard way, where our our executives loved the tool because it was super accurate and great at predicting. But the frontline staff hated it, right? Because it didn't actually alleviate any of the pain points that they were experiencing day in and day out. And if anything, it just created another screen that they had to log into, another platform that they had to log into that didn't actually, provide any sort of, tangible, or not, no tangible benefit, but harder to quantify. And that's really within our inpatient solution specifically, which is kind of one of the legacy products that still exists today within Qventus. It evolved from just being an analytics tool to actually like a fully embedded tool within our customers' EHRs. Primarily, we deal with Epic and Cerner health systems, where instead of a separate screen or a separate login, like it's fully embedded within those systems. And I think ED boarding too, specifically, like we like to take the approach that not only are we reducing excess days on that side and driving efficiency, but at the end of the day, it's a patient safety issue, right? We have a CMO. His name's Dr. Jason Cohen. He's also a practicing hospitalist, and data supports this, that for patients that stay in the ED for 12 or more hours, their absolute mortality increases by over 4%. So think about that, right? Especially for elderly patients, like you do not want to be staying in an ED. And again, a dashboard telling you how long a patient is going to stay is one thing, but a tool that actually, is embedded direct within existing workflows and, providing those insights and guidance along the way, that's going to be much more meaningful. And that's kind of what drove the evolution of the product over time.
Yeah, and I think that's something that a lot of organizations in general, again, like I think there's a lot of the concepts here apply to businesses universally. They can build a great analytics dashboard for whatever the metrics happen to be, but how they translate that into action, right, is really the key
Yeah.
piece, and then improving those metrics. So clearly, you're making a difference in the work that you're doing, especially with a statistic like that one, which is kind of scary. Especially, I'm at that stage of life where I'm a caregiver to an elderly patient, my mother, like making sure that she gets. And so in the cases where she has ended up in the emergency room and then waiting for that bed and her getting admitted, it's an incredibly stressful time period, obviously, for people. And obviously everyone wants them, the people in the emergency department, everybody else in the hospital, but just bed availability and kind of, having some focus on that is a key step that everyone needs help with. So, I know across the hospital, there are some other solution areas where Qventus supports. Do you want to give some other examples of where you focus and some of your products, and how you help apply some automation to those different scenarios?
Yeah, certainly. So I'll kind of go through them in the context of a patient journey and follow a patient along their care continuum and chat through kind of where Qventus plays specifically. So let's assume that we're dealing with a cancer patient, right, who just received a pretty difficult to comprehend diagnosis and needs surgery. In that specific patient, right, like time is of the essence, and it's critical that the patient gets their surgery as soon as possible, because that's going to yield, um, hopefully a better prognosis down the road. Getting that surgery on the schedule, you'd be surprised, even if you're dealing with a relatively sick patient, who has an immediate need for care. Sometimes these surgeries take much longer than they should to get on the books. So the first one of the first three solutions that I'll chat through in the context of Qventus is what we call our surgical growth solution. That's all about filling ORs with the right case at the right time, obviously with the right surgeon. And again, this cancer patient example, we create white space via our team of AI assistants. I'm not going to go into the details of that right now, but we found that 30% of OR time often goes unutilized. Within that 30%, about 70% of OR time that goes unutilized is within partial blocks. So I'm
Mhm.
not sure how familiar you are with basically surgeon block schedules, but typically the way that it works is if you're a credentialed surgeon at a health system, you or your team of partners have block for a given day, and it could be one day a week, it could be multiple days a week, depending on how busy you are. Those blocks end up getting filled, rather quickly, right? Especially for busy surgeons. But then also, based on the national averages that I just stated, a good chunk of that block time goes unutilized. So we've developed basically a solution that identifies blocks that have a high likelihood of going unutilized, and then we nudge clinic schedulers and surgeons saying, hey, look, we think based on our models and your past booking behavior, like you have less than a 10% of utilizing this. Oh, and by the way, if you release it by this date, you're actually going to get credit, and it's going to increase your utilization by X, which will keep you kind of within the threshold to maintain the block that you have. So it's really about kind of like driving behavioral science, but then freeing up that time so that it can then get marketed to the cancer patient that we were just talking about, right? And then that case, instead of having to wait several weeks out, we can pull forward that demand to a patient that really needs it, or in other instances, it might be a strategic service line that a hospital is trying to grow. So that's
Which,
our.
I mean, everybody wins in that scenario, right? That's because
Exactly.
the patient, the hospital, the surgical team, and everybody, just the efficiency of it. So that sounds like a really powerful scenario.
Yeah, so that's kind of like phase one is, okay, a patient needs surgery and they've then been scheduled for that surgery. Between the surgery actually getting scheduled and the surgery being completed, especially for complex patients, but this applies to anyone typically going under general anesthesia, you have to get cleared for surgery, right? And there's a whole process that's called the pre-admission testing process, or PAT, where all these steps are required to ultimately get cleared for surgery from an anesthesiologist. That process today is, as you'd expect, highly cumbersome, highly administratively just manual, and typically results in these like relatively meaningfully sized PAT teams of nurses that are spending up to 50% of their time sometimes on just like below license administrative work, again, sending faxes, retrieving records, etc. So we've leveraged kind of the same overarching technology of kind of these AI teammates first within the surgical growth side. Again, that's all about getting cases done sooner, but then also leveraging that to optimize patients more ahead of surgery, right? So if you think about this cancer patient, maybe it's a lung cancer patient, and they're are smokers, right? Like if we can enroll them on a smoking cessation program ahead of surgery, hopefully they quit smoking if they get a cancer diagnosis, but maybe they haven't. That's likely going to yield an improved outcome downstream. Or maybe for a bariatrics patient, we want to get them on some sort of nutritional counseling program. So there's all these things you can do by reaching a patient sooner in their journey ahead of surgery to optimize them. And then it also gives the care teams kind of an intelligent risk stratified list of patients that they have to work through. So again, instead of just looking at the schedule and being like, all right, well, Mike and Toryn are both scheduled tomorrow. Mike's first on my list, Toryn is second. I'm going to talk to Mike first. It would have, a risk score that it would assign to both of us and every other patient, so that patients could be effectively prioritized and, again, optimize ahead of surgery. And then ultimately what that means is reduce cancellations, right? So there's nothing that a lot of surgeons in particular hate than having a case get canceled, up to 72 hours in advance, but often sooner than that. But by doing all these things upstream, we can get ahead of that.
Yeah,
and then
that makes sense.
the last piece that I'll mention is our inpatient capacity solution. And I talked about that one a little bit at the onset. We actually no longer have the ED boarding tool, but an extension of that has been what we call inpatient capacity, which again, that's all about accelerating throughput throughout the hospital, especially as you think about if you're starting to grow your surgical volume and starting to optimize patients out of surgery. Some surgical patients inevitably are always going to end up in various inpatient settings. So we have a solution that's bidirectionally integrated within the EHR that's all about reducing excess days and creating additional capacity for hospitals.
Yeah, that sounds good. Yeah, and I think that kind of looking at it based on a patient life cycle and all the kind of the different points of assistance that are needed. Again, kind of this concept of helping the clinicians work at the top of their license and avoid, much of that administrative work is really a key piece. When you think about that and helping those care teams focus more on patient care, are there some key workflows or metrics that you're looking at as you kind of roll this out with your customers to help them understand the value that they're getting and kind of go for the low hanging fruit, or what's the approach on the implementation side of things?
Yeah, I think we a couple pieces, like we're building our all of our platform and our capabilities. Like we want it to be as seamless as possible for the end users, right? So I keep touching on this aspect of EHR integration. Like this is fully embedded within Epic, fully embedded within Cerner. We can support other EHRs as well, but we don't want to create additional work for the users of the tool. In a lot of instances, they may not even know that they're interacting with Qventus, because a lot of the agentic capabilities are just kind of like always on, happening behind the scenes. So that's kind of like, as we think about building product and deploying product, like we want it to be a seamless, delightful user experience. In terms of some of the tangible value or impact that it's driving on the surgical growth side, we're seeing about 2 incremental strategic cases added per OR per month. So again, that's 2 patients that are now seen earlier because of this white spaces that's been created and then strategically filled. On the second solution, the perioperative care coordination solution, I mentioned the reduction in cancellations. We're also seeing up to a 50% increase in staff productivity, right? Because you can deploy the agents to do a lot of things that nurses today are doing. Sometimes it can go even so far as talking to the patient via, and you'd be surprised actually like how solid our engagement scores are thus far with patients interacting with the Qventus assistants. They can email, they can read, they can write, they can actually speak in a bunch of different languages. And the feedback, generally speaking, it's kind of initially people like, oh, like, do people really want to be engaging with an assistant? And once you hear it, it's like, wow, actually, aside from the assistant introducing itself as an assistant at the onset, I may have not even known that I was talking to an agent. It's pretty remarkable how far we've come. So that staff productivity beast is a super tangible benefit that we feel really good about, again, because it lets care teams spend more time with a patient and less on the administrative task. And then lastly, on the inpatient side, we're seeing about a 15 to 30% reduction in excess days and about 30 effective beds created for like an average 500 to 600 bed hospital. So again, those are beds that then can be filled with patients that really need the care.
Yeah, that's amazing. I think that having some metrics to go after, I think it's really hard when adapting it or adopting any kind of new software or technology solution or operational solution to try to figure out like what are the metrics that we should be driving. But it obviously helps working with an experienced team that's done this before with others and can at least put it on the table and say like,
Yeah.
this is, you may be a little different, but our other customers typically go after these kind of metrics and see these kind of results. So it gives you some targets to go after. And obviously I'm sure they customize it for themselves. Thinking about that, when they get started with something, what are they typically going for first? Is there kind of a good use case? We tend to advise our customers when they're talking about applying AI to their organization, and we work with both payers and providers. But we're always saying like take something that is maybe a quick win, a smaller win with not a super high risk, right? Take something that's kind of reasonable, bring it in, prove it out, get the staff on board. You've made the point a couple of times during this discussion about how important adoption by users, right? That people feel like this is actually helping them in their jobs, not adding more to their burden.
Yeah.
But where do you see people kind of starting with this family of products and kind of adopting these solutions?
Yeah. I mean, it really it depends on the need, right? Like we want to deliver a solution that's going to provide measurable value to our customers. So in terms of, I wouldn't say there is like a prescriptive path that every customer follows and that every partner follows. And what I articulated, that's kind of our 3 core solutions today. We're continuing to expand and really, again, think of us as this like end-to-end platform that automates care operations across, we talked a lot about, hospital settings, but that could extend into other sites of care down the road. So it's really about how do we leverage those agentic capabilities and go super deep in specific solution areas where there's going to be tangible value and that aligns with a problem that a partner is looking to solve. So that's how we approach it, is really problem oriented, right? Like what do you tell us what your goals are and maybe what's getting in the way of achieving some of those goals, and then based on that we provide recommendations based on what we know we can do really well. I think one other piece that I will just comment on quickly is we wanted to validate a lot of our thinking with the markets. We actually just wrapped up recently a pretty interesting set of interviews and surveys, some of which have actually been featured in publications like Fierce Healthcare and others, where we interviewed a bunch of hospital CXOs, primarily focusing on CIOs, about specifically in healthcare and providers in healthcare, large health systems. What is your AI strategy? How are you thinking about, leveraging AI, right? Totally absent Qventus. We just wanted to get their unfiltered take on, AI is something that is impacting my life meaningfully day to day. I'm sure it is for you as well, kind of outside of work, just personally, and wanted to get kind of a varied perspective from the hospital CIO lens to kind of validate their thinking and understand how they're thinking about it. And I doubt you're super surprised by this, but what we found is that between 60 to 70% of senior leadership across the providers that we spoke to said that their AI strategy is limited or fragmented.
Mm,
66%, again, that's well over half, right? So even though
yeah.
we're hearing all the advances that ChatGPT and AI is making, like the reality is most people are early in their journey, right? And may not have a strategy fully baked out. And that's okay. I think that's if there's any kind of like takeaway from this, I think it's reinforcing that like you're not alone, that you're, if anything, you're somewhat in the minority or more of an exception if you really kind of have a super robust AI strategy built out. So because of that, we would never advise that someone just dives into AI for the sake of doing AI, right? Define your problem statements that you as a hospital operator or a clinician or an IT leader know better than anyone. And then once you've defined those problems, then go out and look for a solution, that may be able to alleviate some of those acute pain points. So we like to be kind of problem first oriented, right? Like don't just dive into AI for the sake of diving into AI. Help us understand what your needs are. And then if we think it makes sense, yeah, there's probably some efficiencies that and value that AI could drive. But we
Yeah, and I think that for a lot of just it's their imagination, right? They may not have imagined how AI can help because it's such a AI is in some ways a limitless tool, right? It can be applied so many different ways, so creatively to a variety of problems. So
yeah,
it's kind of like, in some ways, it's the silver bullet that can solve everything, and in other ways, it's so hard
exactly.
to apply it because it's so nebulous, right? But
Right.
that's
Which
through
I think is the
conversations, I
beauty,
think you
right?
start to figure it out.
Yeah, and that because it is moving so quickly, right? I mean, I think how long is it? We've really been in this kind of like agentic AI era now for the last, 18 to 24 months or so, if memory serves me right. Um, think how much has changed, from just in the last 18 to 24 months. Like that gets me so excited about what still remains on the horizon. And I think that's one of the aspects of kind of this new wave of technology that I'm most excited about is you mentioned this idea of like things are rapidly evolving, but that means that it can be like continuously refined and like very rapidly applied to new solution areas and new problems. And I think we have a pretty significant opportunity ahead of us to try to take advantage of some of that.
Yeah, I think that's a beautiful way to end the discussion. So well said, Toryn. So thanks for joining us today. It's great to hear how you and the Qventus team are helping health systems drive some real action and outcomes with AI agents. For our listeners, we'll include a link to the Qventus website in the episode notes if you want to learn more. Certainly, if you enjoyed the conversation today, we encourage you to subscribe and like and share this episode with your colleagues, and look forward to certainly having more discussions with you, Torrin. So thanks so much for joining me today.
Thank you, Mike. Appreciate you having me.
All right. Thanks again, everybody. We'll see you next time on the Health Tech Edge.